I am Dr. Ashish Bavdekar, Acting Director of Pediatrics at the KM Hospital and also pediatric gastroenterologist. I will be talking in brief today about an overview on Wilson disease. Wilson disease is a rare genetic defect that occurs in approximately 1 in 30,000 people worldwide. It happens because of excess deposition and accumulation of copper in the various organs of the body. Copper is present in most of the foodstuffs that we eat. Most of this copper is required by us for a healthy life. However, when copper is there in excess amounts, that is when the problems occur. Most people are able to take care of this excess copper and remove it from the body. But if you have a genetic defect, which is the problem with Wilson disease, this excess removal of copper does not occur. Hence, copper accumulates in liver, brain, kidneys and other organs of the body and causes the particular damage. Since it's a genetic defect, the copper accumulation starts actually right from birth. However, because it takes some time for a level of copper to build up to cause damage, most people with Wilson disease start developing problems between the ages of 5 and 35 years, though it is also possible for younger and older people to develop these problems. If the copper deposition is more in the liver, people start getting jaundice, abdominal swelling, edema over feet, etc. If the copper deposition is more in the brain, then you get problems related to your speech, your walking, your writing, school behavior, and various other problems. Deposition in the kidneys, bones, and eyes can also be present, causing problems in these organs. What is important for us is to make a diagnosis of this disease very early. To make a diagnosis, you require specialized blood, urine tests, and this is usually diagnostic in most of the patients. However, in some patients, additional tests like a liver biopsy, genetic tests, or an MRI of the brain is also necessary. Once a diagnosis has been made, treatment needs to be started immediately. Any delay in treatment causes problems which may not completely recover. Treatment for Wilson disease basically use medicines which remove copper from the body. They have to be taken by mouth and they have to be taken lifelong. This is very important to remember because if you stop taking medicines or omit a few doses of the medicines, the Wilson disease problems can again start coming back and you could have issues which may be difficult to treat later on. Once you are treated and you take treatment very regularly and the diagnosis is picked up also very quickly, you can make a complete recovery. However, if for some reason the diagnosis is done late or the treatment is not taken properly, you will be left with long-term problems which may never completely recover. Some patients on Wilson's disease who have got liver issues do not respond to the treatment, and in this situation, a liver transplant is the only way forward. What is again important to remember is early diagnosis and long-term lifelong therapy. At the KM hospital, we have been managing patients of Wilson's disease since the early 1980s to 1990s. We have a long experience and large experience of patients of managing this, and hence KM Hospital Pune is now considered and recognized as a center of excellence by the Wilson's Disease International Organization. We offer care for children and adults in terms of management, counseling, and family screening of all the families with patients who have got Wilson's disease. Thank you.